All right, today we're diving into a really important and sensitive topic in pregnancy, placental abruption. Now, this is an emergency that requires incredibly fast action, and understanding it is absolutely key for anyone interested in obstetric health.
So what is placental abruption really? Well, think of the placenta as the baby's total lifeline. It's supposed to stay stuck tight to the uterine wall until after the baby is born, right? It's delivering all the oxygen, all the nutrients. An abruption is when that lifeline starts to peel away way too early, anytime after 20 weeks, and that critical connection gets cut off.
And when we say serious, what are we talking about? This isn't just a minor hiccup. No, this is one of the biggest emergencies a medical team can face on a labor and delivery floor. We're talking about a true, high-stakes, race-against-the-clock situation where literally every single second matters for both mom and baby.
So you might be asking, what exactly is happening inside the body? What are the risk factors? And how on earth do doctors manage this kind of pressure? We're going to break all of that down.
Okay, first up, let's get a really clear picture of the chain reaction that happens inside the body. Because it's really a cascade of events that takes a totally stable situation and flips it into an emergency in no time.
It all kicks off with something surprisingly small. A tiny artery in the lining of the uterus breaks. Now, that starts a bleed, but the blood gets trapped between the placenta and the uterus. It forms a clot, called a hematoma. And as that clot gets bigger and bigger, it literally pushes the placenta off the wall, which tears more blood vessels. And you get this vicious cycle of more bleeding, more separation.
Now here's one of the trickiest parts of an abruption. It doesn't always look the same on the outside. In a revealed case, you see that big warning sign, visible bleeding. But in a concealed abruption, all of that blood is trapped inside, and that's what makes it so incredibly dangerous. A mother can be losing a massive amount of blood, even going into shock, with almost no obvious sign on the outside.
So why does this even happen? Well, while sometimes an abruption can just pop up out of the blue, there are some really well-understood factors that can dramatically increase a person's risk.
The number one culprit by a long shot is high blood pressure. Doesn't matter if it's a chronic condition or something that develops during pregnancy like preeclampsia. Other big risks include having had an abruption before, any kind of physical trauma, like from a car accident, or certain lifestyle choices, like smoking. Even a sudden change in pressure inside the uterus, like when the water breaks when there's way too much amniotic fluid, can trigger.
Okay, so how would anyone even know this is happening? Recognizing the signs is so important. And it's useful to look at it from two sides, what the mother herself is feeling, and then what a doctor or midwife actually finds when they do an exam.
For the mother, the textbook sign is the sudden start of really intense pain in the abdomen or back. This usually comes with some vaginal bleeding, but it's often a dark, non-clotting kind of blood, not bright red. The uterus might feel hard and tender all the time, and of course, a big red flag is any change or decrease in the baby's movements.
Now, when a doctor examines the mother, they're looking for a very specific clue. A tender uterus that feels rigid, almost like a wooden board. That's from all the internal bleeding. On the baby's heart rate monitor, they'll often see signs of fetal distress, a clear sign the baby isn't getting enough oxygen. And in those scary concealed cases, the uterus might even measure bigger than it should because it's filling up with trapped blood. This brings us to a huge diagnostic puzzle for clinicians, telling the difference between an abruption and another condition called placenta previa. The clues are right there in the symptoms. An abruption is painful. Previa is usually painless. The blood is dark red in an abruption. It's bright red in previa. Nailing this diagnosis, and fast, is absolutely vital because the emergency response is totally different for each one.
So, the second an abruption is even suspected, the whole medical team just snaps into a well-rehearsed emergency mode. The goal is crystal clear: protect and stabilize 2 lives at once. The game plan is super systematic and follows a strict order. Number 1, resuscitate the mother. That means getting big IVs started, giving her fluids, oxygen, and getting blood ready for transfusion. A stable mom is the best chance for the baby. Number 2, keep a constant eye on the fetus. And number 3, which is the only real cure, is to deliver the baby and the placenta to stop the bleeding for good.
Right. So delivery is the end goal. We get that. But how they deliver? Well, that is definitely not a one-size-fits-all kind of decision. It is tailored specifically to what's happening in that exact moment.
Look, if the baby is alive but showing any signs of distress, the answer is almost always an emergency C-section. You got to get him out as fast as possible.
But in the tragic situation where the baby has already passed, a vaginal delivery is often the safer route for the mother to spare her the risks of major surgery. And in very, very rare and mild cases where everyone is stable, doctors might just watch things very, very closely.
So after an event that intense, it's totally natural to ask, okay, so what's the outlook? And just as important, is there anything that can be done to stop this from happening in the first place?
And we have to be really direct here. The risk to the baby is very real. Fetal mortality rates can be as high as 20 to 40%. The outcome really depends on how severe the separation is, how far along the baby is, and just how fast delivery can happen.
For the mother, though, the picture is much, much more hopeful. With modern medicine, with quick access to blood transfusions and safe surgery, maternal mortality from placental abruption is now less than 1%. And that's really a testament to how effective those emergency plans we just talked about really are.
Now, while you can't prevent every single case, managing the risks you can control is everything. That means being meticulous about controlling high blood pressure, never skipping an antenatal appointment, avoiding things like smoking and cocaine, and taking simple safety steps like always wearing a seatbelt to prevent any physical trauma.
When it all boils down, a good outcome so often hangs on two things: the speed of recognition, a patient knowing the warning signs and getting help right away, and the swiftness of the medical response, having a healthcare team that's ready to go at a moment's notice.
And that really leaves us with this final thought, doesn't it? The idea of a placental abruption is of course terrifying, but knowledge is the absolute best antidote to fear. Understanding the risks, knowing the symptoms, and having a sense of what that rapid response looks like, that's empowering. It's what can turn a moment of pure crisis into a chance for informed, effective, and life-saving action.